Hello and welcome to Bristol Health Cares. I'm your host, Kurt Barwis. I am the president and CEO of Bristol Health. This program is for you. It's really about how you navigate the system of care, how you access care, and it's really about trying to answer questions you may have and really didn't know who to ask. We are going to bring to you professionals, doctors, surgeons, other healthcare professionals throughout our system of care, maybe people that you've never talked to before or met before, but the goal is to really help you understand how to access care when you need it. You're going to enjoy this program. This program is really for you. So what's important is if there is something that you want to learn about or know about or a guest that you'd like me to host on this show, write us and we'll try to make that happen for you. So enjoy the program, Bristol Health Cares. Hello and welcome to this episode of Bristol Health Cares. I am Kurt Barwis. I am the host of this program. Today, we're going to talk about wound care, and I have a very special guest with us today, Scott Lee. Scott, welcome to the show.
Thank you. It's great to be here.
Tell us about yourself. Before we get into the wound care stuff, tell us a little bit about yourself.
My name is Scott Lee. I'm the director of the Bristol Hospital Wound and Hyperbaric Center. I've been in my position for a little over a year at this point. I do have extensive background in wound care. I've been in the business for over nine and a half years. Started my medical career in respiratory therapy. So I do have a little bit of a clinical background. Ended up in wound care, like I said, about 9.5 years ago, and I've been here. I took a year off, got into a little bit of executive management and leadership with another organization. I was a year struggling personally, and one night, the regional director of Restorix Healthcare, which is my boss, Chris Jones, gave me a call. I was at the dinner table about an hour and a half later. My wife looks at me, goes, "Who was that?" I said, "I think that was my new boss." And then it actually, after that conversation, she goes, "I haven't seen you light up like that in over a year." And the light kind of went off, and said, "This is where I need to be." Came in, interviewed with Bristol Hospital, and been loving it ever since.
No, I love that story because what I say to people all the time is you spend a lot of time at work, right? And one of the most important things is that you're happy and you're enjoying your time. And you know, if you're not happy at work, you make other people miserable, right? Mm-hmm. And I tell people in orientation class every time. I just did one on last Monday, and I say there's one requirement for me, and that is you come to work happy. Because if you come to work miserable, you make other people miserable. So you found your place.
I found my place,
which was really, really awesome, and we're excited to have you in our wound care center. So talking about wounds, you know, let's just talk a little bit about the wound care center at Bristol Health. It's pretty interesting. It's an expansive.
We have a very diverse center, and saying that, we are partnered with Restorix Health, national leader in wound care, over 250 centers nationwide. I just read a review of what we were doing nationally, and we healed out over 100,000 patients last year, which is astonishing. Average median days to heal is 32 across the board. On a local level, though, just in our center in Bristol, we healed over 1,000 wounds.
Wow. So I think that a lot of people, you know, myself included, you know, not understanding, you know, the whole process of, you know, there's wounds that don't heal necessarily on their own, and they can kind of devolve into really, I've heard of and know people with bone deep wounds that they kind of get worse and worse and worse. And what you do is very specialized in terms of helping patients with wounds like, you know, that are really difficult and, you know, hard to heal, kind of reverse that direction and get them better. So how does someone get to the wound care center aside from having a wound? Like, what's the pathway for a patient? Is it a doctor, they go to see their doctor, they go to the emergency room and they say, oh, you know what, this isn't going to heal on its own. We need to refer you to the wound care center. Is it people just call up and make an appointment? How's it work?
It is actually all of the above.
It is.
We get a lot of patients from the emergency room. We get a lot of general practice physicians that send people over with on healing, chronic wounds, which is 4 weeks or greater. We consider it to be a chronic wound. We do see patients call themselves. Hey, you know what? I got this thing on my foot. I can't make heads or tails of what it is. It seems to be getting worse. Well, get in and see us. Give us a call. We'll get you an appointment. The beauty of our particular center is that we are very diverse. I have 2 general surgeons on staff, 2 podiatrists, 2 internal med physicians, 1 vascular physician, and an APRN as well, who doubles as a hospitalist. So I have every aspect covered. And my physicians actually bounce ideas back and forth on each other. If there's something needs to go in a different direction, maybe they need to see a podiatrist. So my general practice physician will say, hey, doctor, what do you think of this? And they'll kind of run patients back and forth. That helps with the overall healing rate because it is a whole system that we need to heal.
Scott, when we created the wound care center, that was the conversation was, do we do it out in the community in a freestanding setting, or do we do it on the hospital campus? And what really kind of moved us to the hospital campus, even though it was a very difficult build to put it where we put it, was the fact that we felt that the specialists would rotate through that center, different days of the week, different blocks, and we'd have much better specialty engagement in the center. And diverse specialty engagement in the center, which it sounds like that was a really good decision.
That's absolutely what you accomplished. And like you said, we're on campus, but we're off campus. We're up behind the actual hospital, across the street from most people in Bristol know the tennis courts. We are across the street, white building, blue roof. If you ever need to stop up, make an appointment, feel free to swing in.
Yeah. So one time the doctors parked right across from where that building was. So that was the other reason why, even though it's not attached physically to the hospital, it made a lot of sense. Now, you have hyperbaric chambers. You have 3 hyperbaric chambers?
2 hyperbaric chambers.
2 hyperbaric chambers. So what's that all about? I mean, I always think about people with diving accidents and things like that. And
this is a therapy. It's actually one of our advanced therapies. We follow what's called the 7 steps to healing. Follow a specific protocol set by Restorix, and our physicians are all trained in it. Starts with blood flow. Blood flow is the most important thing to healing a wound. If we don't have blood flowing to it, it's not going to heal. Hyperbarics actually allows us to kind of attack that in a couple different ways. This thing called Henry's Law, which is what's the word I'm looking for? Physics. Law of physics.
Law of physics. Okay.
Law of physics. Kind of like putting a cap on a soda bottle, keeps the carbonation in.
Yeah.
We do that, but with the oxygen in your blood. So we're able to get oxygen to the actual wound internally at 100% oxygen. So we're able to heal wounds quicker. You have to meet a certain criteria in order to get into the hyperbaric tank, but it does marvelous things. The other thing that we're looking at now is actually big pushes status post-radiation. Radiation internal burns from patients that have radiation, maybe 10, 15 years ago. The rule of thumb is it has to be at least 6 months in order to qualify, but we're healing wounds internally through the hyperbaric chamber.
Wow. So to use your analogy, you put the cap on the soda bottle and you keep the carbonation in. You go into the hyperbaric chamber, which is kind of a glass enclosure, and it fills up with oxygen.
And pressure, we're actually dropping. It's kind of like diving. That's why they refer to it as a dive.
So the pressure kind of forces the oxygen into the wound area, and then it accelerates the healing process.
Healing. We also have angiogenesis, which goes on, which we're building blood vessels. So a combination of the 2 things going on, giving the blood actually more of the ability to carry oxygen and actually delivering it, and then producing more tiny blood vessels, is a win for healing.
Wow. So is it like, you see these shows, the diving, they get in the hyperbaric chamber and, because there was an accident or something like that. So is it a scary thing to get into that hyperbaric chamber?
Not at all. Not at all. It's actually an enclosed capsule. It actually has a TV that we have on top. You'll meet with one of our hyperbaric techs, and she'll actually go over what type of channels you like to watch and so forth. So we could actually make the treatment go by much quicker. It's usually about a two-hour treatment that we do 5 days a week. That will set you up on a schedule. And like I said, we have the TV going. People will be popping in. Our nurses will stop in. Hey, Mr. Jones, how are you today? And we have a phone that we could actually conversate back and forth. So it makes the time go by rather quickly.
So when you're inside, you said it's pressure and oxygen. How does it feel? I mean, like, do you feel the pressure?
You don't feel the pressure, no.
You don't feel any of it. It's like you're laying down on a bed, but you just happen to be in this closed-in.
Some people think it's a little bit hot. We actually have a vent that we could turn on to circulate the air a little better, and that sometimes cools them down a little bit.
So this approach to healing wounds, I mean, does everybody get that, or just some people get that?
You have to meet a very specific criteria in order to meet that. Generally speaking, a diabetic wound that has gone into the bone, osteomyelitis, status post-radiation patients are another classified patient that we could get in. But for the most part, it's the diabetic as well as the osteomyelitis, which is the infection of the bone.
Yeah, I know real well with my brother. He's an adult, he was a child diabetic, and so not healing very well is pretty common for diabetics. And wound care is very important to him and to others I know. So now, not everybody gets the hyperbaric chamber, but a wound anywhere on a person's body? I mean, can it be, you mentioned internal wounds too.
Yeah, typically at the wound care center, we're treating wounds. So most of our wounds that we see are external. A lot of foot and lower extremity wounds. The two biggest types of wounds that we see are the diabetic foot ulcer and the venous ulcer, venous leg ulcer.
Yeah.
And those are both caused by blood flow. The venous leg ulcer has to do with the blood accumulating and the fluid accumulating in the lower extremities. The heart's not pushing it back. It ends up pooling, and then it actually ends up turning into an ulcer. Diabetic as well, a lot of times people have neuropathy, so they don't feel their feet. So one of the things that we recommend to our diabetic patients is check your feet daily. They have mirrors that you could look at the bottom of your feet, make sure they're nice and clean. We had an instance back a few months, we had a diabetic person, had not really good feeling in his feet. Ended up, he was eating peanuts about a week before, dropped a peanut into his shoe, didn't realize it, ends up coming to us with a foot ulcer.
Wow. So the peanut,
sat in his foot. He didn't realize, he didn't feel it because of the neuropathy, the lack of nerve sensation in his foot, led to a diabetic foot ulcer.
As you age and you talk about checking your feet, sometimes it's hard to do. For some people, I mean, even cutting my toenails now is an experience because I figure out how I'm going to get down and do that.
Most importantly, go straight across.
But the idea of checking, so I would imagine you'd probably also say, if you can't do it, have somebody else do it.
Have someone else do it, or there's mirrors that go on at the end of a little stick.
Oh, right.
And you could actually look and see what's going on. But that's actually very important to, first of all, diagnosing it quickly. You see a little cut there. Cuts lead to diabetic ulcers actually very quick. So we want to address that as soon as possible.
So there's all kinds. I mean, I've heard a lot about the lack of blood flow to the legs and stuff like that. And then you see, it's interesting. I see some athletes now are using these pressure devices that have like manifolds, and they actually create circulation in your legs to kind of do what you said, that the blood gets stuck down below, doesn't come back up, and you got to keep that circulation going.
Yeah, we actually have a company that came out to us recently regarding lymphedema, which is the fluid accumulating, and what this actually does is exactly that. It kind of increases the pressure going up your leg, and it actually makes the fluid kind of dissipate throughout the body as opposed to sitting in the leg. One of the other things that people can do at home, which is much easier than if you can't get the machine, is actually just make sure your legs are elevated. That'll help with the blood flow, bringing it back to the heart. It'll decrease the likelihood of venous ulcers.
So it's interesting because, like, for Christmas, I bought my wife one of those machines that you were just talking about. And because she struggles sometimes with the fluid when we're traveling. But they look like ski pants. But it's really, so I have to be honest with you, I use it every once in a while because it's actually rejuvenating. I mean, and then I looked online and there's actually places that they count that as a spa treatment for people. I was kind of surprised by that. But no, I think realizing how important your feet are and how the ability to walk and ambulate and taking care of your legs and your feet and constantly being vigilant and looking to make sure you're not missing anything. So for some people though, they go to they have their toes clipped and they have their feet checked on a regular basis. I mean, I know that's really important for some, especially adult diabetics, right?
Very important. On your yearly physical with your general practice physician, they should be actually looking at that, doing a quick spot check on your feet. But again, like I said, get a little mirror, kind of look at it yourself. Not wait for the entire year to go by before you have it checked, because a little cut can end up in an amputation down the road. In fact, I think it's 85% of non-traumatic amputations started as a diabetic foot ulcer.
Is that right? That's a pretty significant percentage. So what's it like for somebody when they come to the center? I mean, they arrive there for the first time, so they got a wound. Maybe they never had one before. How's that process work? We do
our first initial visit is a thorough evaluation on what's going on. We got to get to the bottom of why you have a wound. Is it the diabetes? Is it the venous ulcer? We do what's called ABIs. We check the blood flow in your feet, make sure you have blood flow, because if you don't have blood flow, we're not going to be able to fix it. Then we look at, sometimes we'll do cultures on wounds to see what exactly is going on with the wound. Is there bacteria in there? Do we need to start with an antibiotic? Do we need to go that route? So we kind of look at the entire system or body as a whole. And we do interact with a lot of the local offices. So if your general practice physician sent you over, we'll respond back, hey, this is what we think is going on, and kind of make it a team approach. In terms of walking into the center, when you first go in, we create like a family atmosphere up there. As much as we love to heal our patients, a lot of them are actually sad to be healed because they're like, I'm going to miss coming here to see you guys. So it is actually a special place. We have we call it a gong, like the Gong Show. And it's more like a healing gong.
I have not seen that. I have to go over and see that.
We'll get you up there to see it. But when patients heal, you'll hear the gong going off and everyone, cheers for them. And it's one of those things where we're happy to see you go. Hopefully we don't see you back, but in a lot of cases we do see them back just because of things that go on in the progression of the progression of the comorbidities that people experience.
Yeah. That's so you come in, you're being assessed, and then, I always hear them talk about debridement of a wound. What does that mean?
We just actually cut the wound back a little bit and make sure we have healthy tissue growing. So it's essentially cleaning the wound.
Cleaning the wound.
And we could do that with a surgical instrument. We could do it with chemicals. We could do it with just kind of scrubbing it. Our nurses are well versed in that, and as well as our physicians.
Got it. So then you just talked about chemicals and supplies and stuff like that. So a lot of times I hear people, they have special bandages, and I see special bandages on people, and some even have like some kind of a vacuum device on it.
Wound vacs.
Wound vacs. So what is that all about?
Wound vacs, what it does is it actually takes, it's actually a vacuum, and it actually gets rid of the extra fluid of a wound, and it keeps it nice and clean. And then they come in weekly or bi-weekly, and sometimes 3 times a week to have that changed. Our wound, it's got to have a nice seal on it, which is important, and our nurses are specialized in that.
So in other words, to hold the vacuum, you got to have a good seal on it and everything. I've heard a lot of stories over the years. I can't remember when we built that center. Do you remember when we built that center? 2014. 2014. What I remember most is we used dynamite to blow up the hill and behind the hospital. That was and we actually announced it over the loudspeaker that we were going to dynamite. Sometimes I have to think about like what we've done over the years, but that was one of the most unique things that we did. But I've heard, we often will get patients that travel really far to our center. I mean, I can remember somebody from New York City coming, they were struggling multiple times to get their wound to heal elsewhere, came and actually was successful. The success stories are amazing.
And we do. We had someone recently come in. He was actually living in Rhode Island. And he had heard about us. He was with us years ago and ended up moving and wanted to drive back weekly to his appointments because he had that great of an experience with the wound care center.
Yeah.
Because I was like, you're driving by 15 other places.
Right.
But it actually touched me that he wanted to drive that distance to come to us. It says a lot about the care that we provide and the care that my staff and physicians actually provide to the patients.
So you mentioned earlier that we did 1,000 wounds, I think is what I heard you say. We healed 1,000 wounds.
Healed 1,000, yep.
And that is in a year, or is that?
That's in a year.
In a year. That's a lot in a year. So how do we look at like quality and outcomes? Because that's obviously a pretty significant outcome. Are there standards? Are there benchmarks that we look at? How do we ensure?
Yeah, there are standard measures that we look at. We look at wounds every week. I have a meeting Monday morning with my hyperbaric tech. We look at every wound in detail to find out where it's going. Okay, do we need to change course of treatment? Then we'll talk to the physician. Hey, just a reminder, this particular patient's been here for 3 weeks. We're not seeing, a 40% healing rate. We want to kind of change things up a little bit on our next visit. So we actually look, like I said, at every wound patient and every wound and decide, hey, you know what, this is taking a little bit longer than we'd like. Maybe we need a skin sub. Maybe we need hyperbarics. Maybe we need a deeper debridement. Maybe we need surgery. It depends on the actual patient themselves and the wound, but we do analyze that. We have an overall 94% heal rate. We actually had 3 awards this year for patient satisfaction as well as clinical outcomes because we've healed at such a high percent rate.
I was aware of the awards, and so I was like, what you just described, I really wasn't aware of, is that you have this team approach where you're constantly evaluating the patients. You're kind of sequentially going through them every week to make sure everybody's on track, and if they're not, you're coming up with alternatives because everybody's different, right?
Everyone has their own care plan.
Yeah.
And like I said, we're not afraid to pivot. And maybe we need to go a different action because not one treatment works for everyone.
Yeah. So Scott, this has been really informative. I think, the viewing audience is it's not a subject that you typically turn on the TV and see. So like key takeaways for the viewing public, like in terms of what they should be looking out for. I mean, you mentioned earlier taking a mirror and looking at your foot, but is like, what's the most important thing for them to know about
Look
wounds?
at your feet daily. Make sure that there is no open wound. And as soon as you see something, call the office. That's the best way to start, and that way you prevent it from growing and getting further because they get infected actually rather quickly.
Yeah.
And like I was saying about that amputation rate, we don't want to turn into that. We want to stop the amputation. But anyway, if you give us a call at 860-585-3397, you could set up an appointment. Our front-end coordinator, Nicholas, will be happy to take all your information, and we'll get you started. The other thing that you can do to help prevent it is, we spoke about the venous ulcers.
Yeah.
Keep your feet elevated. Recliners, things of that nature. Let the blood flow back to the heart.
Great. Scott, thank you so much. This is it's a really an area of pride for our organization because we didn't have it. We didn't have the wound care center before. We had a partial program, and since 2014, I think we've done a lot to take care of this community, and I'm very proud of the team that's done it. So thank you very much.
Thank you for letting me get the word out.
Yeah. So this is Kurt Barwis, Bristol Health Cares. You can write me with your topics, things that you'd want to hear about on this program at cares@bristolhospital.org. Again, that's cares@bristolhospital.org, and we'll work to get whatever that is on the program. I want to say special thanks to Nutmeg TV. This is a high-definition studio. It's extraordinary. It is an amazing community resource, one that I'm very proud to be a part of or be able to use. Programs like this wouldn't happen if we didn't have a nonprofit TV studio like this. So please support this program, this organization with your dollars. Contribute if you can. And until next time, stay healthy. This is Bristol Health Care's Kurt Barwis signing off.